Well, good evening, and thanks for joining us here tonight on Health Quest. I'm Randy Gardner. Joining us at the desk tonight, Dr. Rob Elder, a chiropractic physician here in the St. Louis area. Glad you could join us here on the show. We appreciate it.
Thank you.
We're going to talk a lot about the back today and all the problems that the back can cause the rest of your body. So many misconceptions out there through the years. Let's start off by one of the biggest misconceptions that you have probably heard is that this is a painful thing. When people come to a chiropractor, they lay on the table and you just crank on their back and crack all their bones.
Yeah, that's sometimes people come in with that fear. One thing that we do is we walk everybody through the procedures. We adjust according to the tolerance of the patient. I take care of infants in my practice, so obviously you have to be very delicate with a small infant. We have patients that have osteoporosis, so the adjustment itself is dependent on what the patient can tolerate. And we make sure that the patient is very aware of what we're going to do. No surprises. That's one of my mantras in my practice is, you know what, Randy? No surprises in my office. I don't like surprises except for my birthday, and you're not going to get any here. So.
How have you seen things change since you started in this business?
You know, unfortunately, with insurance companies and the dictation of healthcare, it's really driven by money, unfortunately, and a lot of times doctors' hands are tied. We want to do procedures on patients that we know can benefit them, but the insurance companies make you jump through hoops, and it's really unfortunate because the patient's the one that suffers. So it's a lot harder to take care of the patient the way we want to with the insurance industry in the way.
Now, did you always grow up wanting to be a chiropractic doctor? How did you get into this?
You know, I always wanted to be a doctor. Even when I was a small kid, I had the stethoscope in the little bag, and I knew I was going to be a physician. I was pre-med, and I studied at the University of Missouri Columbia Hospital. I was going to go into ophthalmology, and I had a personal experience with chiropractic that saved me from surgery. And it was interesting because I always thought chiropractors were a bunch of quacks. But it was my grandmother, she would drive 2 hours a couple times a week to get adjusted by her chiropractor. And I didn't understand what chiropractors did. I was basing what I thought about chiropractors on opinions versus facts. And when I really looked at what a chiropractor does and the education behind it, I thought this is really interesting, and I think I want to pursue this avenue.
You talk about the word adjust, and you've said it several times. For the people who have never been to a chiropractor, what does that word mean? An
adjustment, there's two different things that a chiropractor can do. One is manipulation, and one is adjusting. What most patients receive at a chiropractic office is what is called a manipulation. And a manipulation is a gentle force that's directed into the spine or another joint, let's say a wrist or an elbow. We actually adjust all sorts of joints, not just backs. And that manipulation actually increases range of motion, it decreases pain. That's really what it's for. And we utilize that with patients when they first come in. An adjustment is directly applied to correct the spine back to its ideal normal position. So that's the difference. A manipulation will never change the spine on pre and post x-ray. What we do in our office, it's very different. We can get into this. It could be an hour in itself what I do, but we actually do what's more like orthodontics to the spine, and that's how I describe it to patients. You know, there's dentists and there's orthodontists. I'm more in the orthodontist sense. We do spinal correction. So is it all done at one time, or is it a correction that happens a little bit with each visit? It's a little bit at a time, much like braces. When patients go to an orthodontist and get braces on their crooked teeth, you can't fix them in a day. The way you correct spines, the way you correct crooked teeth, is it's force and pressure over time. And we do it in a procedure in a way that a patient is comfortable. We proceed at their pace, not our pace, and I make sure that patients understand that. And I tell them, I'm going to challenge you. I'm going to challenge the way that you think about your health. We're going to challenge your spine to make it correct, but not to a point where it's going to be painful. What's the biggest mistake you see people do? Why they come see you? What's the thing that makes them come? A hurt back, picking up too much weight, standing incorrectly? Well, people should be able to do whatever they want to do. The biggest thing I see is lack of maintenance. Could you imagine going to a dentist? And I'm going to ask you how old you are. 37. 37, okay. Let's say you never went to a dentist before. And you walked into that dentist's office, you said, I've never brushed, I've never flossed. What would that dentist tell you? Randy, your teeth are a mess. I see patients that have never had their spines checked, that are in their 30s, 40s, 50s, and they come in and they're a complete mess. And they've got arthritis, and that's another misconception is arthritis. That as we get older, we get arthritis, and that's not true. Arthritis is from the joints being out of position for a long enough time, and it's left unaddressed. So what I see is lack of maintenance. People don't take care of their spines the way they should, and we teach patients how to do that. We teach them how to check their own spines and when to know they need an adjustment. It's not based on pain, but it's based on structure. So if my patients come in and say, you know, my head's shifted to the right side, or I've got a rotation of my pelvis versus, hey, my back hurts today. And it's an education process.
Are these things that the average individual can kind of consult themselves on to see and feel what is wrong before they come see you?
Absolutely. There's some very simple tools that we teach patients. We do workshops in our office to teach patients what to look for. Because doctor means teacher, and I want to teach my patients how to take care of themselves. One of my jokes is you've got 5 minutes in here with me, and you've 23 hours and 55 minutes to screw it up. So let me tell you what to do and what not to do. We teach patients how to check their own posture. And a very simple thing is to look at your head in relation to your rib cage. If your head is not in alignment, if it's shifted to the right or to the left, for instance, that is a postural alteration, and that is damaging. If your rib cage is out of alignment from your pelvis, you can look at yourself in a mirror, and if your belly button doesn't line up with that notch underneath your throat, then there's a problem. And so we teach patients this. There's side views that you can't see yourself, but you could have your wife look at you from the side, and if your ear doesn't line up with your shoulder, then there's a health problem. And often it won't manifest with pain, but it will eventually.
Now, are these things that can be corrected, as you mentioned, if someone has never been for 35 or 40 years and then they come see you, are these things that can be corrected over a couple of years since it's been out of whack for 40 years,
right,
per se?
It depends on each patient. We have to take it. We can't cookie cutter a procedure into an office. So every patient that comes in, it may dictate different types of care, different lengths. The shorter amount of time that subluxation, spine being out of line, has been in the spine, the easier it is to correct and the faster it is. Some patients are uncorrectable. They wait too long, their spine is completely fused with arthritis, and we just can't do much correction. So there we're setting a goal of, let's try to get you as comfortable as we possibly can and maintain that comfortable state.
One thing most people would say, and I didn't even know this, is that a chiropractor will take and work on several different parts of your body, like your hands or your joints all over. Is that something you've always done? Yeah,
extremity adjusting is probably 25% of my practice. I see people that come in with knee problems, ankle issues, wrist problems. And once again, we don't just adjust the knee, let's say. We have to find out, well, why is that knee not functioning correctly in the first place? So I will look at the structure of the body. A pelvic rotation will definitely affect the knees. And so we have to address the whole patient, not just a body part.
What is the correlation between, you mentioned before, we went on the air about expanding and bringing in physical therapists to work. Talk to us about the correlation between the chiropractic side and the physical therapy side.
In my office, we do mainly structural correction. Once a patient's out of pain, they have the choice to either stop care or continue with spinal correction, which means fixing their spines. So we can actually integrate different healthcare professions together and work together as a team approach, chiropractic, physical therapy, medical, in order for the patient to get the best care, the best results quicker.
To kind of break it down for the average individual out there, is it basically the chiropractors work on the bones and the joints, physical therapists work more on the muscle and rebuilding of that? How does that work?
Well, it depends on the chiropractor itself. I do a lot of muscle work. When you're dealing with postural correction, structural correction, you have to address the muscular component. And so that's where a physical therapist can be very helpful in that correction process, because that way I can focus on the patient's structural, bony correction, and the physical therapist can focus on what they know best, which is a muscular component, and do the mirror image exercises and things like that. And once again, work as a team, consult together as a team, and have a medical doctor in there as well. Because a lot of patients come with a myriad of complaints. They're on 15 different medications, they're going to 4 different doctors, and there's got to be communication. And so that network, when we set that up, the patient gets the best care.
What about words of wisdom to the weekend warrior who goes out, you know, he's 30, 40, 50 years old, thinks he's back in high school, goes